Assalamualaikum warahmatullahi wabarakatuh. Hello, my name is Ersi Arianti. I come from class 2A of Diploma Nursing of Sultan Ageng Tirtayasa University. I will read an article entitled "Four Respiratory Disease to Watch Out For." Respiratory system is one of the most important process in life. The reason is by breathing the body will get the oxygen it needs to produce energy. This is very necessary for survival. Not only that, the breathing process also helps the body to get rid of a waste substance called carbon dioxide. For this reason, maintaining the health of the respiratory system is an important thing and must be done. However, not infrequently, there are several types of disease or disorder that can interfere with this function. Disruption of the respiratory system indirectly can also interfere with the overall performance of the body. This is because the body doesn't get enough oxygen. So, to avoid this, it is necessary to know the types of respiratory disease that need to be watched out for. The first is asthma. Asthma is a long-term disease that attacks the respiratory tract. This condition occurs due to inflammation and narrowing of the airways and causes shortness of breath or difficulty breathing. Symptoms of this disease can arise due to several things, such as dust, animal hair, cigarette smoke, gas, strong odors, stress, cool air, and illness. Recurrence of asthma with symptoms of shortness of breath, chest pain, coughing, and wheezing. This disease should be watched out for, especially if there is a severe asthma attack or status asthmaticus. These attacks usually do not get better, even after presenting the drugs. If you experience this, the person needs immediate first aid to save the airway. The second is bronchitis. Infection that occur in the bronchi, aka the main respiratory tract of the lungs, cause bronchitis. This disease will also experience respiratory problems due to irritation and inflammation that occurs in the respiratory tract. Common symptoms of this disease are cough with phlegm, sore throat, muscle ache, and headache. This disease must be watched out if followed by other disorders such as asthma or COPD. This is because the symptoms that appear can be more severe. For example, the skin looks bluish or pale because the oxygen forces in the blood are no longer adequate. The third is chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease or COPD, a group of lung disease that result from inflammation. This condition causes damage to the structure of the airways and respiratory problems. The bad news is that COPD is a progressive type of disease, which is a disease that gets worse over time. The smoking habit is one of the main triggers for this disease. Even so, this disease can still attack people who do not actively smoke. Apart from smoker, other factors that can cause this disease are exposure to cigarette smoke, air pollution, chemical fumes, and dust in the long term. In addition, genetic factors can also be one of the causes for a person to experience this disease. The last is allergies. There are types of fire which are reaction to shortness of breath reaction. This happens because of the swelling of the airway. When the body responds to allergens, aka allergens, there is a change. This will happen. Symptoms that appear as a reaction are itching for the skin and eye mucosa, coughing, rapid pulse, awareness, and cold hands and feet. This condition requires immediate first aid, especially from experts, to prevent potential death due to airway obstruction that occurs. Uh, Thank you for listening my explanation. Goodbye.